All right. Once again, welcome back, everyone. Allow me to introduce Carol Gould, Carol S. Gould, who is professor at the Department of Philosophy at Florida Atlantic University, where she's also a distinguished teaching fellow in the Center for Future Mind in the FAU Brain Institute. Carol publishes widely in aesthetics, ancient Greek philosophy, philosophy of psychiatry, and more recently, Japanese philosophy. Her forthcoming book is Glamour, A Philosophy of Elusiveness, Bloomsbury. Congratulations, Carol. We look forward to that. And Carol received her PhD and BA from University of Buffalo, SUNY, studied at Brown, and is also a philosophical practitioner of many years standing based in Boca Raton, Florida. And her talk today is titled Philosophical Counseling as a Tool for Addressing Body Dysmorphia. Welcome, Carol. The floor is yours.
Hi, it's a pleasure to be here today to share my ideas with you. I'm giving a paper on really a pathology. It's not the usual kind of problem our clients come to us with, but I'll be interested to hear your comments. And I love these meetings, and I'm really delighted to be giving a paper this year. So I'll start by telling you a little about the background of it. Excuse my voice. A physician friend of mine who had audited a couple of my classes in philosophy of psychiatry and adjacent areas, he knew of my work on philosophical aesthetics, and he gave me an article on the role of aesthetic sensibilities in body dysmorphic disorder, which I'll refer to hereafter as BDD. The authors offer, and in this article, the authors offer powerful arguments for the hypothesis that patients with BDD had more heightened aesthetic sensitivities than the general population. Without elaborating here on their arguments and the merits of them, let's just stipulate that at least many BDD clients are aesthetically sensitive. Body dysmorphic order is a pathological loathing of one's body or some part of it. And it is a pathology, and we don't, as philosophers, we don't think of ourselves as dealing so much with pathologies as with existential issues or moral dilemmas, organizational issues, and so forth. But one reason I think body dysmorphic disorder is particularly interesting here is because it shows how philosophy can work in conjunction with medical or clinical treatment. So it's not, in its extreme form, it's rare. But it was first classified in 1987, officially classified in the revised DSM-3. And some consider it one of the most devastating maladaptive psychological disorders. And we can see why. Its victims feel profound self-consciousness about a perceived flaw or set of flaws. It's notoriously underdiagnosed. And, patients, in part because patients are reluctant to report their symptoms. Even patients who will admit to an array of other symptoms, which many would find more shameful, even, having murderous impulses, even having, a rather sociopathic history. They don't want to talk about their bodies. They feel shame and discomfort, in some cases more shame than they do in talking about their characters. Now, this is exactly the case with a client of mine, not that he had felt murderous impulses or anything terrible like that, but I had a patient who told me with some shame and discomfort that he had BDD. He had a touch of BDD, and which was more than a touch. Now, it's, as I said, we'll see, it's a highly maladaptive condition that makes people live with self-disgust, to avoid relationships, and to lapse in meeting their academic or professional obligations, and to have even friendships. Usually they have dysfunctional family situations, or they create them. Their situation creates it. They might find it hard to live normally with others and may spend exorbitant sums on cosmetic surgeries or what we'd call enhancements. And I say enhancements, let's call them purported enhancements. And I'm not speaking here about, about the odd nip or tuck. Rather, they have facelifts, rhinoplasties, biceps, and other implants. Use your imagination. Some people with normal genitalia, in fact, have unnecessary reconstructive surgery. And this is particularly sad, and in part the result of, I think, the prevalence of pornography in our culture, and in a sense, the technological advances that have allowed it to be so specific, so exaggeratedly so. But one of the most chilling surgeries that I heard about with conjunction with BDD is that of procedures that patients endure to add height. Now, this is surgery with a recovery time of a year or so, and often much of it in a wheelchair, no less. There are some BDD patients who pull at their hair compulsively, pick their skin, eat strange things. Many resort to procedures, not only self-punishing, but also, in many cases, beyond their financial means. Some people have even gone bankrupt because of it. Now, most therapists take it as a form of either OCD and or delusional disorder. There are two subtypes of BDD. There's first muscle dysphoria, which is found mainly in men who feel that their musculature is inadequate or that they are too small. And then there's body dysmorphia disorder by proxy. Very strange. And it's exemplified by those who are utterly obsessed with what they perceive as a flaw in someone else, usually someone very close to them, like a child, a parent, a significant other, romantic partner, life partner. Whatever its guise, therapists usually treat it with either CBT and or SSRIs. These, however, are mainly palliative. And this is where philosophical counseling can come in to accompany a clinician. It can help the patient attain, philosophical health, and also, I think, a new sense of value, both moral and aesthetic. Now, insight may not cure the obsessive problems, and they may not, conceal them or even erase them in the way that, say, a medication might. But once found, insight is not lost, and it can gradually integrate itself into the personality, the patient's personality. And that can be highly favorable, have highly favorable outcomes. Now, I'll argue here that philosophical counseling can provide this unique sort of help if the counselor aims at bringing a person to envision a life with new meaning and to revise their narrative and to reassess their values, their structure of values, their hierarchy of values. And also, I would like to say too, that we might look to the idea of philosophical health as Louis de Miranda conceptualizes it, helping one refashion their, quote, sense of the possible, as he calls it. Time doesn't permit me here to rehearse what he calls his sense-making method, but I will discuss the particular sorts of insights that a practitioner may help the client achieve, and which would give them a new sense of the possible. First of all, the practitioner can help the client first attain a strong sense of, one, the distinction between the ethical and the aesthetic, which is critical. Two, the ethical injustice that they inflict on themselves through self-objectification and diffidence. Three, how for some, this is a response to cultural pressures, and most importantly, four, what it is to have a truly acute sense of the aesthetic and its role in a person's self-worth. By acquiring self-knowledge and understanding of the culture in which they are embedded, the client would begin to reinterpret and write a healthier narrative for their future. And I don't want to digress, but I will digress very briefly and say that one of the projects many of you may know that I write on the aesthetic properties of persons, and have been deeply immersed in a monograph on the subject. So that's so in a sense, when I say an acute sense of the aesthetic, I'm not talking here simply about art. I'm talking about something much broader, with a broader boundaries, more elasticity. Now, so if the patient can acquire this self-knowledge and understanding, they would undoubtedly begin to see a new sense of the possible. They would see new possibilities for their future, and perhaps rewrite or re-envision their narrative. The tell-us for a patient with BDD, or a client, let me say, that for us with BDD would be, as Lewis would have it, a new idea of the possible and renewed sense of meaning. The pertinence of his method, especially for body dysmorphia disorder, is that it, quote, proceeds from a primary dimension of embodiment and sense of self to, quote, a conceptual worldview. His ideals are akin to those of an existential and person-centered therapist. Let us note from the start here that a philosophical counselor, or what we call philosophical practitioner in some places, should acknowledge the client's concerns rather than dismiss them as delusional or vain. However inauthentic or frivolous the practitioner may find the client's concern with physical perfection as the client sees it, the counselor must create an empathic therapeutic environment in which a client can comfortably air their concerns without feeling judged, lest they not articulate or admit to them. Now, philosophers, I think, are especially well suited for this. However, I think that we are extremely well suited to be vulnerable to the error of, or making the error of judgment, of value judgments, because in the history of philosophy, this has been a motif. the idea of, the value of appearances versus reality. And I'm going to get into that in a little bit here. So think about then that Rogerian idea, which is so important, that a counselor should meet the client where they are. That is, validate these concerns. So some philosophers think a preoccupation with appearances is morally suspect, perhaps as an ethical vice of vanity or a dangerously, let's say, unsocratic hierarchy of values. After all, most of us admire Socrates when we read and teach the Apology. We all admire him, if for nothing else, for excoriating the Athenians for caring more for their bodies than for their characters. And one cannot simply tell a client to adopt Socratic values, for we do live in our bodies and in a social world. And Socrates himself cared for his body because he was aware of that. We see in the Symposium that he dresses up, so to speak, for the occasion, which was an elegant dinner party and drinking party at the home of Agathon, the playwright, the victorious playwright that year. And for Socrates, dressing up even means wearing shoes. And he also then, in the morning, when everyone else was sleeping off their hangovers, Socrates got up to work out very early and went straight to the gym. Now, some circles in contemporary culture might deem BDD a form of narcissistic preoccupation with one's appearance, as we said, while others may see that conformity as admirable, as people are encouraged to follow, for example, influencers who encourage body enhancements, some being disfiguring, as we said before. Now, recall that Merleau-Ponty grounds his system on the principle that we live in our bodies, of course. Each of us is an embodied consciousness. It transforms as we interact with others. And more recently, Richard Schusterman, too, has made sophisticated contributions to current philosophical ways of conceptualizing the body, which he points out, many of which he points out, tend to be more disguised social and political critiques than conceptualizations per se. Hence his theory of somesthetics, with which many of you may be familiar. If not consistent with a Socratic hierarchy of values, some concern with appearances certainly is part of an Aristotelian one, which arguably is preferable. And we need not go into that at this moment, but in the 1940s, the pragmatist philosopher, American philosopher, Kurt Dukas wrote a now obscure article called The Art of Personal Beauty, which illuminates this Aristotelian sensibility. His argument is twofold. It's moral and prudential. We have a moral obligation, he says, to be minimally presentable and inoffensive to others. And he says that being attractive to others is of great moment to practically all of us. For better or worse, our personal happiness and prosperity, he tells us, depend throughout life very considerably upon the attitude of the persons with whom we come in contact. Moreover, the contact with many of those who can affect our fortunes is brief and superficial. And the briefer and more superficial it is, the greater the importance of the surface we exhibit, since that is all they have to go by. And that is not insignificant, because consider, say, a job interview where you meet a person for a very short time relative to the length of time you interact with other people. Now, the two ways he tells us that we can become attracted are either by becoming likable or fascinating. The former being more about reality, the other appearance. And likableness is sufficient, and it's about personality and character and how it's expressed, while fascination is, quote, less closely connected to the real worth of its object, unquote. When he talks about fascination, Ducasse equivocates between two different concepts, one being about biologically given beauty, the other about imaginative efforts at self-editing. But one need not be naturally beautiful or adept at self-editing to feel comfortable with oneself. Self-presentation, as Ducasse insinuates, includes vocal and gestural modes of expression. Interestingly, Ducasse was a strong believer in parapsychology and even in the spirits. So he recognized the human interiority. In fact, he has some very interesting arguments about what was in his day called the mind-body problem. And he argued vigorously against physicalism. Yet he was, he argued rigorously and scientifically, in a sense. But now, the person who has body dysmorphic disorder, BDD, lives in double consciousness. Okay, and when you live in double consciousness, a concept that you're probably familiar with going back to W.E.B. Du Bois, you're constantly aware of yourself. You're seeing yourself through the eyes of others that you feel are more powerful than you. And so it makes such improvisational and imaginative self-editing almost impossible. Minimally, it would be difficult. Now, before elaborating on how de Miranda's what he calls his sense-making method, may allow a client to reach philosophical health, and what I would simply say clarity in their worldview, which would be part of it, allow me to present the case of one of my clients with whom I've had at least partial success and hope to have more. And his name is, his pseudonym, is Matthew. Matthew, a man in his 30s, mid-30s, consulted with me to discuss what he thought was his key problem, a troubled relationship with his girlfriend. Now, he was attractive and well-educated and starting a promising career, a very difficult career, and he had a deceptive air of confidence about the power dynamic in that relationship. He thought that he was the one more in charge than she, but that was not the case. And as he revealed more, I learned that he had been sexually and emotionally abused by his father, a wealthy businessman from whom Matthew claimed he was estranged. As the story unraveled, I saw that he was still erotically enmeshed with this woman, both emotionally and physical, even though they hadn't been sexually intimate for a couple of weeks, which to him was a very long time. And both had agreed to redefine their relationship as, quote, just friends. Clearly, he still loved this woman. He was in love with her, as we say, despite what he called her true craziness. He felt he had never met anyone like her, he said. She was physically attractive and they shared a similar worldview. And given Matthew's worldview, that would be hard. Okay, now, with his preoccupations, like-minded women, as we said, would be rare indeed. So, and not insignificantly, and not surprisingly, given his history, he was highly judgmental about and obsessed with the appearance of others, and had some rather questionable, contemptuous ethnic biases. His aesthetic sensibilities were active and attuned to both the visual and literary elegance. Early on, he mentioned in passing that he had some, quote, body dysmorphic issues. Namely, that unlike his brother, he was, would, quote, not strong and naturally athletic. He was quick to add that he was the intelligent and academically successful of the two. His anxiety in discussing his feelings about his body were clear from the way he would mention them and frequently mention them, and then quickly retreat from discussing them in greater depth, which would be a case of Freudian avoidance, of course. Now, after earning an MA in humanities field, he went on to train in a highly skilled, physically demanding, and not only lucrative, but also a profession that required very specific and precise hand-to-body coordination or eye-to-body coordination. I say that because even though he developed his body to be what he described as ripped and perfected to a high degree, this, well, let's not say perfected, but developed to a high degree of excellence his ability to work with the equipment that he had to work with, he still saw himself as small and had concomitant trouble with sexual performance because of it. His problem was more specifically, I would say, given his obsession with his musculature, muscle dysphoria, and he was considering various ways of remedying it. Although he had developed his muscles by working out, and he carried himself almost elegantly, I would say, but he couldn't come to terms with his natural body limitations, and everyone's body has those. Now, my aim was and remains ambitious, which was to lead him to what Lewis would call philosophical health, and also what I considered crucial, which was having some clarity about the ethical injustice he was committing to himself, towards himself. Now, I asked Matthew about his appreciation for language and his visual environment. Since his bodily shame seemed to gnaw him so deeply, it seemed a promising starting point. Also, Louis de Miranda's sense-making method begins with the client's sense of embodiment. Matthew valued art and culture and felt that he appreciated it more than most other people. He has a nimble mind and broad education, fairly, I'd say, higher than average aesthetic appreciation, or finely honed aesthetic appreciation. I asked him what he thought about Walter Benjamin's well-known notion of the aura. Benjamin argues that once artworks are mechanically reproduced, they lose their aesthetic value because an original has an irreplaceable aura unique to itself. And it's that aura that defies reproduction. Okay, so persons being distinct individuals are like artworks in that each is different and distinct from all others. No matter how closely one copies, say, an influencer, these nefarious influencers, one cannot achieve qualitative identity At best, one might be a kitsch reflection. Similarly, a guy more ungainly and unattractive might try to imitate Matthew himself, Matthew's style of hair, Matthew's gait, etc., and which I pointed out to him. Now, since Matthew's father had inflicted such a deep psychic wound, I worked to help him see himself not as a perfect specimen of masculinity, or even to strive to be one, which, and of course he aspired to be, but rather as a unique and more than presentable individual, and to recognize his uniqueness and to highlight it. We spoke about the plausible Nietzschean idea of a person's life as a work of art. He agreed that a work of art that meets precisely conventional standards of a genre usually lacks interest, even if it is in some sense beautiful. And since antiquity, I reminded him, Persian rug makers would include a flaw in every rug they created. The distinct imperfection was necessary to achieving the beauty of the rug itself and its aesthetic value. More importantly, to the artist, or perhaps not more importantly, we don't know, but the artist would not be tempting God with their hubris of striving for perfection. But we can consider the phenomenon today of art created by AI, and which of course could be mechanically reproduced, and we have these non-fungible tokens, etc. But most of us would agree that the value of those aesthetically is quite different from that of, say, a Vermeer or a Francis Bacon or etc. So in a sense, when someone is striving to approach a usually culturally defined ideal of beauty or physical perfection, it's in a sense like trying to create a work that could be produced by an AI entity. Now, one of Matthew's tasks that he gave himself is to accept his body, and to see its distinctive value, and to take pride in how he worked so hard to become sufficiently strong and agile to succeed, as he was doing, at his physically demanding profession. While he has not yet reached this telos, seeing it as a goal is the initial step to reach it. Aristotle famously begins his Nicomachean Ethics with this very point. If we are to aim at a target, we must see where to aim. To reach the good and attain eudaimonia for Aristotle, we have to have an understanding of what it is. Then I asked Matthew whether he believed that the athletic masculine ideal was universally accepted or should be. He was not sure how he felt about that. Part of the homework he gave himself was to figure that out. Now, this takes me to the next idea I explored with Matthew, who is, like all of us, a work in progress. Matthew, like many with BDD, had been comparing his body or feature of it to others for much of his life. In doing so, he had presupposed that others are worthy of admiration and that he was not. And this assumption sabotaged him in two ways. Okay, it instilled in him a defensive contempt for other people, which wasn't particularly attractive, and it interfered with his having a mature relationship. So I brought up an ethical matter, ethical in the sense of character, a character by which I mean a character primed to achieve virtue. And excuse me, I'm missing a page here. I have a page stuck. But let me go on. And for Aristotle, as everyone knows, virtue is a mean between two poles. We have a virtue, and then we have a vice, and then we have a virtue is between two poles, an excess and also a deficiency. Okay, so if you have a virtue, say courage, you're neither rash nor are you cowardly. So Aristotle speaks, as we know, not only of virtue, but per se, but of individual virtues, all of which are quite controversial. As is the notion of the mean. And each invites controversy, perhaps none more so than his virtue of magnanimity or great souledness, what he considers the crowning virtue. Okay, the crowning virtue, because it's inseparable from every other virtue. It involves respect or honor. To be a great-souled person is to have a proper sense of self-regard and to know what one deserves and to expect it from the world. His notion may seem elitist and culturally embedded and thus inapplicable today, but it can be brought up to date. It's a mean between an unwarranted sense of entitlement and a self-disregarding diffidence. Okay, it's worse, according to Aristotle, to be unduly self-effacing than to be conceited. Matthew initially thought he might be guilty of excess self-regard or arrogance. But then I asked him to consider his feelings about his body and how they have suffused his feelings about his life in general. And to be great-souled, one must see oneself as deserving honor from those from others, those of good character, that is, and honors that are worth caring about. And one wonders if, being seen a certain way, unless one is off the charts, something, is, the most important thing to strive for. He appears to be shifting his feelings, but that may require him to examine other elements that bestow meaning to his life. Now, the ethical point he has to internalize is that to honor others more than they deserve and to dishonor himself for something not earned, but rather won by genetic lottery, is to be unjust. He's being unjust to himself. And I'm saying this unjust in the distributive sense. A Kantian might accuse him of violating the categorical imperative. But when I say that he's being unjust in the distributive sense, I'm thinking of Aristotle's notion of honor and respect from others as being something one deserves to have. As we would say, people deserve to have education, a home, etc. Okay, nutrition, so forth. Well, for Aristotle, when he says honor, he means respect from others. And so if Matthew gives it to others, but not to himself, denies it to himself, he's depriving himself of an important good in life. And so he's demanding, and that happens when we demand more of ourselves than we would of others. The ethical, so that he's being unjust. And the other element in De Miranda's approach, as he discusses in a soon-to-be-published paper, tapping into the unimpossible, among other places, includes, if I may paraphrase, selfhood, belonging, new life narrative, a sense of what he calls a sense of the possible, purpose, and a coherent philosophical vision that governs their life in the world, and feelings of a self with agency. Matthew has an arduous path to achieving self-knowledge and certainly agency. He needs a sense of purpose that is coherent and befitting of someone of his intelligence and capabilities. So he is starting to look differently at his body, and in doing so, is viewing himself quite differently. This is painful for him because it's forcing him to reassess the relationship, this relationship that's so important to him, that was both feeding and fattening his insecurities. So, however painful this may be, it's allowing him to, in asking him to perhaps reassess that and whether it is important, is to allow him to confront questions that previously terrified him, namely those about his body. If all of this works out as hoped, Matthew will be giving himself what few manage to do, or to have the courage to do. That is, choose the path that will take him to a place of more meaning, and please forgive me, I lost my place. And that is to achieve a sense of meaning that goes beyond developing a body that rivals his brothers. Now, so it will give him a newly gleaned sense of the possible, and a new destination in seeing meaning as more important than physical appearance and his effect on others. So to conclude with Matthew, in exploring his moral values and ideals of character, have hastened his psychological recovery with his other clinicians. Not all clients need or seek out clinical treatment, but even those who do not can benefit from work with a philosophical practitioner on values and meaning. And also, I would toss in here, partly because we're dealing with Matthew and partly because of my own interest, to incorporate the aesthetic into the notion of life having meaning and interest. Okay, thank you very much. I look forward to your questions and comments and criticism.